Hello guys, welcome to my channel. In this video, I'm going to discuss about the disease modifying anti-rheumatic drugs. This is main drug which is used in our daily rheumatology cases, and it is also one of the important 5 mark question in university. Let's start DMARDS. Usually, this is modifying anti-rheumatoid drugs. It improves the symptoms and also it modifies the disease. We can classify into the two types: non-biological drugs and biological drugs. In non-biological drugs, we use immunosuppressants and immunomodulators. The main drug is methotrexate and azathioprine and cyclosporine, and others are sulfasalzine, hydroxychloroquine or chloroquine, and leflunomide and tofacitinib. And biological agents are lots of biological agents available. uh, IL-17 inhibitors, IL-20 inhibitors, TNF alpha inhibitors. The TNF alpha inhibitors are mostly used, and that's are etanercept, infliximab, and adalimumab. And the others are anakinra and abatacept and rituximab. And lastly, in the video end of the last slide, I'll show the picture of this biological agents. And let's enter into the important drugs. First is methotrexate. It is preferred DMARD in the treatment of rheumatoid arthritis. It has relatively more rapid onset of action other than the DMARDs. It is the folate antagonist, and the dose of methotrexate used in the rheumatoid arthritis is lower than the dose needed in cancer chemotherapy. It is an anti-inflammatory effect. It inhibits hemotaxis of the neutrophil and decreases the production of the pro-inflammatory cytokines by the activated T cells. Methotrexate is administered orally or subcutaneously. And along with methotrexate, we have to give folate drug, and it is also used for psoriasis, polymyositis, and arthritis and dermatomyositis. The adverse effect is nausea, vomiting, mucosal ulcer, and dose-dependent hepatotoxicity. Hence, hepatic function should be we always monitor periodically. The adverse effects minimized by the administration of folic acid or folinic acid. The contraindication in pregnancy and liver disease and peptic ulcer. It aggravates the peptic ulcer. And next drug is chloroquine or hydroxychloroquine. This is the anti-malarial drug, and it is also used in the rheumatoid arthritis. We don't know the exact mechanism of the action in rheumatoid arthritis, the chloroquine drugs, but it decreases the release of lysosomal activity and inhibit the inflammatory responses. So it can easily tolerated by the patient, so we can administer it orally. And it is bound to tissue protein and deposited in melanin containing tissue, especially in eye. Prolonged usage of the chloroquine leads to corneal opacity and retinal damage. So we have to ophthalmic examination should be periodically, at least once in a year. And the other side effects are nausea, vomiting, and skin rashes. The drug is relatively safe in pregnancy. And next drug is sulfasalzine. It is used alone in the mild disease, and it causes remission in active rheumatoid arthritis and also used in the chronic inflammatory bowel disease. It administered orally, and the common side effects are nausea, vomiting, diarrhea, headache, skin rashes, and leukopenia. Here, sulfasalzine is metabolized to sulfapyridine and it is absorbed into the circulation. It inhibits the production of superoxide and inflammatory cytokines by monocytes, and it is beneficial effect in rheumatoid arthritis. And also the other byproduct is 5-amino salicylic acid. It produces the local anti-inflammatory activity in the gut, so it is used in the ulcerative colitis. And coming to next drug is leflunomide. It is the active metabolite. It inhibits the dihydroorotate dehydrogenase. It decreases the pyrimidine synthesis of the cancer cells. It inhibits the T cell proliferation, and we can use it alone or combination with methotrexate. And the effect is, it is as the same effect as a methotrexate. The adverse effect is loose stools, loss of hair, liver toxicity, and leukopenia and skin rashes. We can easily remember, note here all are L. Loose stool L and a loss of hair and a liver toxicity, and it is contraindicated in pregnancy and lactating mothers. And coming to the biologics, we completed non-biologics and coming to the biologics. First one is TNF alpha inhibitors, that is etanercept, infliximab, and adalimumab and golimumab. And ILN1 inhibitors is anakinra. And T cell activator inhibitors are abatacept, and rituximab is a IL-20 inhibitors. The most common adverse effects of biological usage is it aggravates the opportunistic infections like tuberculosis and respiratory infections, skin rashes. And these are all used in the rheumatology. Here you can clearly see CD20 inhibitor is rituximab, and PAF inhibitor is belimumab, and T cell activator inhibitor is abatacept, and IL-23 inhibitor is gulselkumab, and IL-17 inhibitor is secukinumab, and TNF alpha inhibitors we already know, and IL-6 inhibitor is sarilumab, and IL-1 inhibitor is canakinumab and anakinra. These are all the main biologicals which is used in the rheumatology, and also some other cancers treatment also. That's it. Thanks for watching. If you really want more 5 mark questions related final years, subscribe to my channel and chat to your friends. Bye.